Okay, so here's the deal. I'm a doctor. I was trained alongside other doctors. I don't know what the heck they are saying out there, but when they say you can't take hormones, it is the dumbest thing I've ever heard, because there are almost 100 different hormones in the body, and a hormone is just a chemical messenger. And so would a doctor ever say to you, you can't take insulin because you've had breast cancer? Absolutely not. And insulin is a hormone. Would a doctor tell you that if you had low functioning thyroid, that you couldn't take thyroid hormone because you've had breast cancer? So you see what I'm saying? Can they just say you can't take hormones? Let's be very specific. And if we're going to be very specific about what hormone it is that you can or can't take, then we have to talk about progesterone, testosterone, DHE, or estrogen. Okay, so let's talk about estrogen. And if you can't take estrogen because you've had cancer, let's be specific what kind of cancer it was. And if it was even breast cancer, which is the one that scares everybody with estrogen, let's talk about different kinds of estrogen, because there are different kinds of estrogen. So you can't just say you can't take estrogen. There are 3 kinds. So your body takes cholesterol, which is actually a hormone too, turns it into progesterone, which is another hormone, and then into 3 different kinds of estrogen: E1, E2, and E3. E1 is a little bit of a problematic estrogen if you're a 50-year-old female. If you're a 9-year-old girl trying to grow breasts, no big deal. But if we have too much E1, that can be a problem. But there's a protective E3 that will actually go bind up the receptors on E1, and you can have this powerful effect, protective effect. And E3 is a very good estrogen to have a lot around of. E2 is a neutral one, protects your bones, your heart, your brain. So this is a very good estrogen. And when you take bioidentical estrogen, you can give a woman just E2 and E3 and have wonderful protective effects on all of the systems that estrogen actually protects and serves in our bodies. So I am so tired of the narrative, and I have actually had a doctor in the past that had told a patient of mine, this was a breast oncologist who specializes in breast cancer, told a patient that she couldn't take bioidentical hormones, and he had no idea what E1, E2, and E3 was. That is just such a lack of knowledge. Just ask, is this true? Because that is the basis of everything. Just ask, is this true?